Alrighty, good morning, good afternoon, and good evening, team. This is week two with discussion number one for MPA 593 Professional Presentation for Public Administration by Eric Sandoval. And today is the 22nd of May. So let's go ahead and dive right on in. So our very first question was, what was the name of the organization that we chose? And I selected a nonprofit organization by the name of St. John's Community Health. Essentially, they have a little over 60 years that they've been in action. Well, I'm sorry, that they've been open for. Um, but just a small little bit of background about St. John's. So they are a community health clinic that offers a range of services. They offer medical, dental, behavioral health. For some patient programs, we have case management. There's also Cal AIM care management. We have committed to Black wellness and health. We have domestic violence, harm reduction program, health education, legal services program, outreach and advocacy, and then also we have Rise Reentry program. And then a little bit about health services for ranges from medical, dental, pediatrics, mental health, substance abuse, prime specialties such as HIV, AIDS, Hep C, PrEP, pharmacies. We also have benefits counselors. So it's a range of services, right? So that's just like a little bit of background about like some of the services that they offer. So it is a community health clinic, but a slight history, briefly. So at St. John's, they've been open for a little over for a little over 60 years. They began in 1964 at a small, like, little church, and then ever since then, they've been able to expand into different areas apart from Los Angeles, such as Riverside and San Bernardino counties, and essentially they provide quality care and accessible care to the most underserved communities. And essentially, what began as a small volunteer run clinic has grown into a nationally recognized network of community health centers committed to equity, compassion, and impact. And then let's go ahead and dive into our next slide. So, community serve. Where is St. John's and what are are the people of the community being served? So, it originated in Los Angeles, and there's over 28 clinics, and we have four school-based clinics. So that being said, the clinics are school-based, and we also have four mobile units. So what the mobile units are, they're these huge RVs, and in those RVs, they're meant to provide medical services. So we'll have a doctor in there, we'll have an MA, we'll also bring our front desk receptionists and our benefits counselors. And that's one of the cool things is also at St. John's, we do have on-site benefits counselors. So that's awesome. And then we are fortunate enough to stretch out into the Inland Empire. So now we're also in San Bernardino, San Jacinto, and and then also in Indio. Alrighty, and then let's go ahead and head off into our next slide. So our core values, mission statement. Now, what's awesome about St. John's is essentially what sets us apart is that we don't just treat illness. We invest in people. You know, St. John's combines high quality medical care with social support services that address the root cause of poor health. And But essentially, a few of our core values. First and foremost, we begin with dignity. So at St. John's, we honor and respect every person we encounter, whether it be a patient, a colleague, or a community member, as a valued part of the human family. And then next off, we have excellence. So we support and champion the best standard of care, personal and professional growth, accountability, creativity, teamwork, and a steadfast commitment to quality. Furthermore, well-being. We promote and advocate for the full integration of our patients' physical and mental health in order to enable them to participate in their own health improvement and become active and responsible members of a vibrant and just community. And then social justice. We collaborate with others to develop systems, organizations, and programs to advance equity and fairness in allocating community resources and to empower and address the needs of all community members, especially the most vulnerable and disadvantaged members. Um, so those are just a few of the core values, and then but essentially the overall mission statement as well is to improve the community health and reduce health disparities by delivering high quality, comprehensive services and impacting health and social policies. And throughout my time working at St. John's, I do want to say that the work is phenomenal. Um, it's been a really great and meaningful line of work. And then so and then we have our next questions. Being able to make a positive impact. What is it that we do to make a positive impact? Where does it begin? So what sets us apart is we have many different aspects. You know, we're culturally competent. We have bilingual care teams. Our staff reflects the community we serve, offering respectful language, accessible care that builds trust and connection. And then also we have outreach and advocacy to reduce systematic barriers. Our street-based outreach teams meet people where they are and advocate for policies that advance health equity. And that's in the department that I'm in. And it's been an amazing job. I don't see myself going anywhere for a good while. Um, so then next up we have our integrated behavioral health and wellness program. Therefore, we treat the mind as well as the body with in-house therapy, substance use, and wellness services woven into primary care. And then we also have community first model with deep local partnerships. Therefore, meaning we collaborate with schools, churches, grassroots organizations, and civic leaders to expand our impact and stay rooted in community needs. So we are community focused. And then lastly, we have supporting for housing, food access, and legal needs. So we also help connect patients with essential resources, including housing assistance, food programs, and legal advocacy to improve overall health outcomes. And then lastly, it's care for all, regardless of insurance or immigration status. Everyone is welcome at St. John's. We never turn patients away due to inability to pay or documentation status. And then, some of the importance of our work. Some of the importance of our work comes in many different ways, as I just mentioned. Uh, from integrated behavioral health to outreach and advocacy, we try as much as possible to work with our community to the best of our ability. As mentioned, we work with people regardless of their inability to pay or their documentation status, and we don't turn anyone away. And also, like at my community health clinic, we have so much open availability. There is no wait time. So that kind of helps cut out the emergency room or the health clinic if you're looking to go because you're sick. And then and furthermore, this is a little bit of our board of our directors. It is a little bit hard to see because I use snipping to get all the images. But essentially, this is our board of directors. We do have a very dynamic team. I myself have personally met a good handful of these. Darren Harris, I'm in his department, and I've also met Elena. She is a wonderful woman, and the one on the right as well. It's hard for me to see because it is a little blurry on my end, so I can only imagine on your end. And then Jim Manja, he's the CEO. He's such an awesome CEO. We meet with him very frequently as well. and he's very active, very engaged. We attended a rally where we're fighting for healthcare in LA to help prevent to help prevent a lot of public hospitals from being closed. And furthermore, then this is a little bit of our contact info, our website and social media. The first link above is about us. So a lot of the information uh, that we went over today and you would like further, you could find on our website. And we also have a call center. And there's a little bit of our links for Instagram, YouTube, TikTok, and LinkedIn. And I do thank you all so much for your time. I look forward to your feedback. I hope you all enjoyed and have a great rest of your day. God bless.